Okay, it is now 11:13,
Okay, I think I
and
have
we're
it
going
off
to
now.
continue our webinar presentation on Medicare 101. Uh, you can see that there's a lot of information that we have, and Medicare, as you see, can be pretty complicated. So what we've gone through so far is Social Security and a Medicare overview and Medicare um, traditional versus Medicare Advantage. Now, John Kaiser is going to do a presentation on the drug plans, Medicare Part D. So, John, I'm going to show your slides and take it away.
All right, thank you, Howard. Next, I'd like to present information regarding Medicare Part D drugs. Actually, it's gotten a lot less confusing because of the changes, which I'll take you through. First of all, not everyone needs a standalone Part D drug plan because the Advantage plans, as I mentioned, generally include a drug plan. Medigap plans, however, do not. So if your Medicare Advantage plan includes a Part D plan, you still should input your drugs into the MA plan so you know your total cost. You don't want to go signing up for an Advantage plan and find out later that the drug costs in there are prohibitive or that the formulary within that plan does not include your drug. That would be disastrous because then you're paying full price for a drug. The annual election period is actually the same as the election period for Advantage plans. It's from October 15th to December 7th. Now, if you're turning 65 or when you're first eligible to enroll, you're not governed by those rules. Veterans also, I understand, have a pretty good Part D drug plan that they can avail themselves to if they're enrolled. You should enroll when eligible or you face a future premium penalty. It can be quite significant. It's 1% a month, 12% a year, times the average premium. What that amounts to is if you were to wait, either you forgot or didn't realize that you got to sign up. If you were to wait 10 years, your premium would be an extra $40 or some dollars a month. And so it's pretty important that you enroll, even if you enroll with a zero premium plan, just to make sure you're enrolled. Again, that's if you don't have an Advantage plan. Input your drugs at Medicare.gov or provide the list to a consultant or a Part D insurer to determine the least cost. So I'm going to show you a bit on how to use this Medicare.gov site. I think it's real neat. I think you've done an excellent job with it. But you also can go to the consultant you're using on your healthcare and give them your drug list and ask them to calculate it for you. If you go to a Part D insurer, I mean, you got to go to each insurer you're considering and give them all your drugs. That's somewhat tedious. The best method is to go to Medicare.gov and do it on your own. But again, you can use a consultant. The difference in drug costs can vary significantly between different insurers, and you're going to see that. Different ones charge different prices for the exact same drugs. You got to price your spouse's plan separately because their list of drugs generally different. It's seldom that you have exactly the same drug list. You don't need to have the same insurer. You want to go with whoever's going to be the least cost for you individually. You may need prior doctor authorization for some brand drugs. Some drugs are not covered unless you take the generic, and then you got to get permission to use the brand. And sometimes you have to have tried the generic, but that's something you can do. It's not too difficult to deal with from experience. It's always less expensive to use the insurer's preferred pharmacy and maybe the insurer's preferred mail order pharmacy. I'll show you a little more on that. I did write a detailed document, Understanding Medicare Part D, and it's on the website under ncro.org under the Insurance tab. It includes more instructions for using the Medicare.gov's website and a few more words than I'm giving you with these slides. So what it does enables you to just sit and read through it again. You already have a plan, because some of you tuning in already have a plan. The Medicare.gov site enables you to check out your existing plan compared to cost of other plans. When you first bring it up, it shows your plan and what it's costing. And then when you list other plans, you can see if your plan is the cheapest or if you want to make a change. It's also great for doing what ifs. So the doctor says, hey, I want you to go on a certain drug. You can go in there, put the drug in, and find out what it's going to cost you for the year or for the month. I use that a lot. You always have the option to use the healthcare consultants, like I said, and we have the 3 that we recommend on our NCRO's website. CMS, the Centers for Medicare Services, Medicaid Services, they've approved significant price reductions for some high-use, high-cost drugs for 2026. There's a list out there. I'm disappointed that you got to wait till 2026. Why aren't they approved for 2025? But regardless, they finally negotiating some reductions on some of these higher cost drugs, which is good news. So general rules, pricing. Like I said, different drug manufacturers will charge insurers and therefore you differing prices for the exact same drug. That's why you've got to check it. Formulary, that's the Medicare Part D insurers list of drugs they're going to cover and which tier they fall. Very important that your drug is listed in your insurer's formula. If you've got a drug that's not in that formula and you want to stay on that drug, it's going to be very expensive. Generally, that'll pop out though when you do the analysis because it's not paid for, and it throws the whole analysis out of whack for that particular insurer because it'll be very high cost. In case of tiers, for the purpose of pricing of copays, insurers generally use 5 tiers. First, you have preferred generics, non-preferred generic, brand, non-preferred brand, and specialty. Quite often, a preferred generic will be free, a non-preferred will be a minor cost, and the brands get to be around 25%. Specialty is really referring primarily to like chemo-type drugs, and a lot of those get covered under Part A in the hospital. So for 2025, things have changed for the better. There's no longer what you heard of as a donut hole. The donut hole is gone. What you have is now 3 stages instead of 4. Stage 1 is you pay your deductible. And for 2025, it's at $590. Some plans, if you pay a higher premium, will charge you less than $590. Some will even charge you a 0 premium. But you have to look at the total cost, not just whether or not you're paying a premium. Then there's stage 2, that's the initial coverage. You'll have a copay for your drugs based upon which tier the drug is classified. I just took you through the tiers. You're in this stage until your drug costs, including deductible, reaches $2,000. So that if you paid the $590, that counts towards the $2,000. So now it's pretty simple. Once you got past $2,000, which isn't a small amount, but once you've got, it's been much higher in the past. Once you've got past that $2,000, you're in stage 3, which is catastrophic coverage. And in this stage, your drugs are 0. So you don't pay anything the rest of the year, but you do have to keep paying your monthly premium. So that's why it's important you look at that premium. You want to be paying some high premium the rest of the year, and your drugs are 0. However, you got to look at the total. You got to look at the premium, you got to look at the deductible, and you got to look at the drug cost, because you may not be hitting the 2,000, but so you still want your lowest cost. Through this chart in here to help show you what's happened the last 3 years. Orange is what you pay. The Part D plan, the insurer, is the blue. The drug manufacturer is the green, and then the Medicare is the black. If I go to the middle, 2025, and start at the bottom, you paid 100% because you're still paying your deductible. And then your initial coverage, you paid 25%. That's for a brand drug. During the coverage gap, you paid 25, but you got credit for the 70%. And then once you got to catastrophic, there's no orange. So once you got to catastrophic this year, 2024, you didn't pay any more, but you had to get there. Whereas in 2025, without going through the numbers, it's only going to take $2,000 to get there. So you're going to pay again at the bottom, deductible of 100, then the 25, but then your Part D plan is going to cover 65, and the manufacturer will cover 10, and then you get into catastrophic. What's going to happen here, though, is the insurers going to be paying more. And I haven't seen rates for next year, but I'm wondering if they're not going to get it back in their rates their everyday rates for their premiums, but that remains to be seen. Those rates will be out the end of this month. So most insurers charge a deductible $590 for 2025, but the total cost, like I said, premium deductible must be your focus. If you choose a retail pharmacy for your drugs, use your insurer's preferred pharmacy. I'll show you that for the lowest cost. Mail order is not always less than the pharmacy. You might find it more convenient, and you might find it cheaper, but it's more and more, it's not necessarily the least cost. If you change insurer, and you could do a mix there, you could do some of your drugs mail order and some of them over the counter. If you change insurers, you won't need new prescriptions except for mail order. Mail order will require you to send in new ones if you change insurers. If you change pharmacies, you just ask the pharmacy to transfer your prescription drugs from your prior pharmacy if you're changing pharmacies. In January, then you would show your new Part D insurance card to the pharmacy of your choice. For 2025, Part D enrollees will be eligible for a monthly payment plan for drugs under the new Medicare prescription payment plan. They call that MPPP, and that was part of the Inflation Reduction Act. What that means is if you're in a situation where you can't pay for the drug up front, the whole amount, you can enroll in so-called monthly payments. And if you do that through your insurer, and if you do that, when you go to the drugstore to get your drug, it's free. It's free with that pharmacy, but then the insurer will bill you monthly. See, it's a payment plan for expensive drugs. Okay, so you can easily enroll at the Medicare.gov website. I'll show you that in a minute. You can confirm the cost with your chosen insurer by contacting them and providing your drug list. You can also enroll you, of course. So if you've gone on site or you've talked to a consultant and you think you know which company you want, it wouldn't hurt to call that insurer and say, here's my drug list, and see if you get the same cost. You don't have to do that. And then you can enroll then. The later you wait between October 15th, December 7th, the harder it is going to be to get through to these people, these insurance companies. Trust me, you're going to be online a long time. You can use the Medicare.gov website. If you decided which insurer you want, there's a box that says enroll, and it takes you like 5 minutes to enroll. So you can enroll through the website. And if you have an existing plan, they will go in and cancel with your other insurer and send you a letter that you've canceled the old one, and then you get another letter that says, here's your new one. Your chosen healthcare consultant can also help you with selecting insurer and completing your enrollment. I said that. You have several premium payment options. You can pay out of your Social Security. It'll take it right out of your Social Security check. You can, a lot of them take a credit card, which you get the points, or you can do auto pay by, through your bank, or you can just mail them in the check. A drug may be cheaper over the counter versus your insurance. I was never a big believer in that, but I'm going to show you an outstanding example next. So this is a script for what's called Taboberol. It's a solution that you put on your toenails for fungus or whatever. And if this script was bought through, first of all, it wasn't in a formulary, and so the person had to go get a permission to get it. None of the insurers in Michigan covered it, even though it's a generic. And then it was $286, but if you hadn't paid your premium, it was another $500. So this person, the first time around, paid $786 for this drug. Okay. If they had known and had gone to GoodRx, and GoodRx is just one of several that offer discount drugs online. You got to have a script, but you don't have to use your insurance. And look at the differences. If you just buy it without insurance, this is an example without insurance, you went to Walgreens, it's $369. You go to Rite Aid, it's $27.84. Now, Rite Aid is closed up in Michigan, but you could go to Kroger Pharmacy and it'd be $34. But that's in comparison to paying $286 plus your deductible if you haven't met it through your insurance. I find it unbelievable that there would be that kind of difference. So my point in showing you this slide is that you can take your drug list and go to GoodRx, type it in, and see if it's cheaper than using your insurance, particularly if you're going to get put into a situation where you got to use your deductible. Okay, now the next few slides are going to show you how to try to use the Medicare.gov site. This is the opening page. They change it every year, so there might be a different person when you open it, if you try to open it another month. But you, on the bottom left here, you click log in or create an account. To create an account, you put in your username, create a password, etc. It's easy to do. The advantage of doing this is that if you go back in, you don't have to type your drugs in. If you use the site without logging in or enrolling, every time you try to use the site, you got to type all your drugs in. So it's a no-brainer to create an account. And this account that you create is also good for any kind of Medicare information you're seeking, like your expense reports, you know, your charges that you get from the doctors and stuff. So you may already have a login number if you're using Medicare.gov to get information. But do this, log in, keep this, and you'll use it over and over again. But once you get in there, open it up, click on Open All Options. You see that in the bottom right. And then you want to choose Find Health and Drug Plans. And again, depending on how they play with this site, these pages could change, but it's pretty intuitive. So you just follow, you just read it and make your decisions. In this case, in this example, this person already has a WellCare value script. So they're over 65. They've enrolled previously. So it tells you your current plan. If you're new, it's not going to tell you your current plan. You don't have one. So then you go over here and you click on Find Plans Now. Okay. So here's where you decide which kind of plan you want to investigate. In this example here, we're investigating drug plans. We want to find out how much standalone drug plans cost. But the neat part of this particular site is you up above, you could click on Medicare Advantage plans. You can down below in Medigap policy, or you click on Part D and Medigap. And then I'll have you put your zip code and your age in, and that'll give you pricing on, just a whole load of plans. And you could pick whether you want a C plan, et cetera, if you're doing gap plan. So if you wanted to investigate the cost of plans, you could do it here just by using this site. I would still go, though, I'd use this to get my information. I would still go to a consultant because there's ins and outs. There's some, for example, with gap plans, there's some insurers that they're tougher to pass pre-existing conditions, or they have higher rate use. In other words, they're going up 5-6% a year, where another insurer might only be going up 3% because they got better experience rates. That kind of information you're not going to get here. The cheapest plan here might not be the best plan. But it certainly allows you to investigate other plans. But we're using this today, right now, to investigate the drug plan. That's what I use it for. Once you get in there, they're going to ask you to type in your drugs. In this case, omeprazole was typed in. They'll ask you the quantity, the frequency, how much of it you use. In this case, 20 milligrams. You just follow the prompts. The other thing it will do, you see there where it says add recently filled drugs. Any drug that you've taken in the last year is going to show up here on the list and prompt you. It may be a drug you took one time only, so you don't want it, but it will show you all your drugs. And so anyways, you create your drug list and hit OK. This is just more of the same. You're going to be asked to put in pharmacies. You can put in up to 5. I generally put in, 3 or 4. I usually put mail order as one of my choices just to have that comparison. You can edit your pharmacies if you've previously done it. And it'll automatically bring up the pharmacies in your local area based on your zip code. It'll come up then with a listing, not like this one, a listing in order, the least cost first of, I think there's 27 of them in Michigan. And then it'll let you click on compare. And so the first one it's going to compare is the one you already have. That's the WellCare. In this case, I chose to compare it to the next cost one. And then, so I compared it to the first three, the least cost. Why go look at number 27? They're going to be more expensive. So you can select them for comparison, and then you can click on plan details for each one. You can even click on roll if you're ready, but I don't think you're ready at this point. But my point in showing you this is that the system allows you to compare up to 3 different insurers. And when you do that, further on the same page, it shows you the cost at the different pharmacies you picked. So it's a little bit busy, but you can see here which drugstore has the least cost with which insurer. And that helps you choose which one you want. Because you pick your favorite pharmacy and then you try to see which guy is going to be, which insurer will be the least cost. And you can see, looking at it, if it says preferred in network, the cost will be less than a standard in network. Stay in that first column, you'll see Kroger Pharmacy 1506 for this drug list. Whereas if you go to, and it's not that much difference at CVS, but if you go to Mills, they're standard. They are not preferred. They are a couple $100 more. These are just examples. Your own drugs will give you different numbers, and if it's not in the formulary, like I said earlier, the number will be sky high and you won't even consider it. But my point in showing you this is that this is the kind of analysis, kind of look you can get while you're trying to make a decision. So my concluding remarks, hopefully it's giving you a clearer understanding. Again, the document is on the website, so you can read through it. It's got these same slides. The Medicare.gov site's easy to use. Investigate your drug costs and choose the lowest cost provider on your own. Keep in mind, you can always use one of our recommended consultants or one of your own. I didn't mention that, but if you got somebody, a consultant that of your own choosing, or a friend's got one they got good experience with, I mean, there's nothing wrong with that. It's just that we only have the ones we recommend, and they can enroll you in Medicare Part D. Patients Assistance Program is something I have not talked about before, and essentially what that involves is if you've got a very expensive drug, each manufacturer, almost every manufacturer, I'm pretty sure it's each of them, have what they call a Patients Assistance Program, and you need to contact them, or if you have a friend who's paying a lot for a drug, chemo drugs are a good example. They can get relief on that. My wife has a drug that is $18,000 a month. Now, of course, under Part D, I'd go through the donut hole. I wouldn't pay that. But with the Patients Assistance Program through AstraZeneca, I'm not paying anything for that drug. And so it's very important that if you or a friend have an expensive drug, that you look into a Patients Assistance Program. Each manufacturer has that program. It works differently for under age 65. After age 65, they're considering that you can probably have a Part D plan. So it's a little more to go through, but it's definitely worth the effort. So that was it. I'm open for questions, and if there are no questions, then that completes the presentation.
John, it looks like you did a good job. No
Thank
questions.
I don't know if they were mad or they just didn't have questions. Well, that went well. That went well.